asymptomatic because, there's 5 different stages of kidney disease. And those first 3 stages, typically no symptoms. When the kidney disease progress, we tend to see swelling of the legs, difficulty breathing, nausea, vomiting, a change of taste in the mouth. People call it a metallic taste. You start to feel weak, tired, and some itching about the body. All these are signs of advanced kidney damage. As you can see, they kind of cross over with other medical conditions. So if you have any of these symptoms, please know your kidney status.
As you're saying it, I'm trying to see if I taste any metallic in my. I guess because like you say, sometimes it goes undetected. So that is fascinating. So kidney disease can really creep up without any type of warning. So now let's talk about who's most at risk. What are some major factors or risk factors for kidney disease, and who should be paying extra attention to their kidney health?
Yes, so the leading cause of kidney disease in the Bahamas is diabetes, and that is actually worldwide. I think about over 50% of our patients on dialysis is secondary to diabetes. Hypertension is a close number 2. Okay, we have a strong family history of polycystic kidney disease. Those who have recurrent kidney stones, on chemotherapy or lupus treatment, all of these are risk factors for development of kidney disease. And it's key to know your status and where your kidneys are if you have any of these medical conditions.
Now, as you said, diabetes, high blood pressure, they're huge issues in the Bahamas, especially when it comes on the kidney. Now, how do these conditions directly impact kidney health, and what can people provide or what can people do to prevent kidney damage?
So if you're a diabetic, you should have your urine and blood checked almost quarterly. Okay, what we're looking for in the blood is we look at the creatinine. That creatinine is going to allow us to estimate our kidney function. When we estimate our kidney function, we can actually put our stage and risk factor associated with kidney disease. But when we look at the urine, we want to see exactly how much protein is in the urine. Mm-hmm. Protein in the urine is a sign of microscopic kidney damage. The more protein in the urine, the faster the kidneys are going to fail. Okay? Hypertensive, you're supposed to be checking your blood pressure twice a day, okay, morning and evening, ensuring that blood pressure, the top number under 130 and the bottom number under 80. And we're staying away from that salt.
Are you speaking to older people, or you're also speaking to the younger ones? You said check your blood pressure twice a day.
Any hypertensive, they're supposed to be checking it. But everybody in the Bahamas should have a blood pressure machine in their house, okay? Wow. I've been seeing more and more 30-year-olds, 40-year-olds being diagnosed with severe hypertension and actually being started on dialysis or having complications as related to the high blood pressure. Mm-hmm. So just because you're young does not mean you're free from having any sequelae of high blood pressure or kidney disease.
Okay, and a lot of people are always saying, oh, money tight, cost of living is high. I actually saw on Amazon for the blood pressure checking, it's like $15.
Correct. And it's free at every medical facility. You could walk in any pharmacy and check your blood pressure. So you can't say it costs money to check your blood pressure.
Okay, no excuses. I like that. Okay, now speaking of lifestyle, let's talk about hydration. We always hear drink more water. Oh my God, I love juice. And I keep saying, well, there's water in juice, right? Isn't there water in juice?
There's sugar in it.
Okay, so how much water does a kidney actually need, and what happens when we don't drink enough water?
So this is a common question I get. It's actually kind of a misunderstanding. There's no actually specific amount of water everybody should drink. It should be individualized. We talk about 2 to 3 liters, but this is variable. This depends on, am I working out today? Am I staying in the sun? Is it summer? Is it winter? Do I have a history of kidney stones? Therefore, I have to drink more water. Or do I have a history of heart failure? I have to drink less water. So everything has to be individualized from patient to patient. Mm-hmm. And people always ask, which water is best? Water is water.
Okay.
Coconut water is no better than water.
Okay.
So water.
Just because your bottle of feed is $10, so mean it's better than that for sure.
Exactly.
Okay. Okay. All right. Now, treatment and living with kidney disease. For those that already are diagnosed with kidney disease, what are the treatment options available, and can kidney disease be reversed?
So I think kidney disease, more so dialysis, it creates this negative stigma. Mm-hmm. And once we hear dialysis, we don't want to check our kidney function because ignorance is bliss.
Yes.
So what we want to do is be identified early. If you're identified in an early stage of kidney disease, then you get more room for protection. if you present in the further stages like stage 4 and 5, we're not talking about prevention, we're talking about preparation. Living with kidney disease is about finding out how to change your lifestyle, making sure you're on the right medications, and making sure everything is protecting you from advancing your kidney disease. For example, there's some medications that shouldn't be used at certain levels of kidney function.
Should not.
Correct.
Okay.
So we need to know exactly where do your kidneys fall in line.
Wow. Wow. Okay. So many people think of dialysis when they hear kidney disease. Now, can you explain when dialysis becomes necessary and how it works?
So more than just a number, we take a full evaluation and sit down with the patient because it's going to be how you feel. So the most common reasons we start dialysis is A, the toxins are too high and we need to clear them out because they're causing some of those symptoms that we talked about, or you're not able to produce enough urine to get the fluid out of the body, so it's backing up in the lungs or so forth. The only other time we would do dialysis is if the electrolytes, like the potassium, is too high, because although you won't feel that, that can actually be deadly to the heart. So these are the things that signal to us to start dialysis earlier rather than later. But that's why you want to continue your follow-up to make sure we say, all right, we're getting there. Let's do this. Let's change this. So you can actually prolong the time when you're not on dialysis. But we still prepare physically and mentally.
I have a question from your answer. You said if your kidneys aren't producing, I don't know if I understood you correctly, and I think if I misunderstood, somebody else did. I think you said if your kidneys aren't producing enough urine, the fluid builds up where?
Yes.
In the opposite direction?
Correct. So when you see that feet swelling, that's going to continue to move up the body. Then you see the legs swollen, the belly gets swollen. Next thing you know, you can't lay flat because now the fluid is around the lungs. And the heart is struggling to get the fluid out, but the kidneys are the only way to get that fluid out of the body.
Wow. Okay. So for those that have already severe kidney failure, a kidney transplant may be their best option. How does the transplant process work, and what are the challenges in finding a match?
Yeah. So when we think about kidney disease, once you get diagnosed with kidney failure, we're talking stage 5. We talk about renal replacement therapy. Dialysis is really only supposed to be a bridge. The treatment for kidney failure is actually a kidney transplant. Until we have up and functioning, running transplant program here in the Bahamas, you want to look at all available options worldwide. Okay. There are many transplant centers, not only in the U.S. The Cayman also does transplant. There's other places on the side of the world. And from place to place, you'll notice that the financial constraints when it comes to transplant is different. You have many Bahamians here living with kidney transplant, and you'll never even know.
Probably, yeah. So when you said look abroad as well, internationally, for the kidney transplant,
yes,
are there any type of assistances when looking for that? Because you don't want to stand up on the black market, right?
So as of now, right now, most of the assistance is done by fundraising or patient-directed. We as healthcare providers, we try to mitigate as much cost as possible. But after you get the kidney, the costs don't automatically stop because you have to afford the medications to actually continue and maintain that kidney. So when we look at kidney transplant, not only being an adequate recipient of a transplant, meaning the heart has to tolerate it, you have to be able to undergo actual surgery to tolerate a whole new organ implanted inside you. But you also got to be able to tolerate those immunosuppressive medications. So you basically have to be cancer-free and those things. So all of these checks and balances need to be in place. On top of that, if you have a donor, that donor has to be fit to give up one of their kidneys. Now, we have 2 kidneys, and we really only need 1 to live. Okay, 1 kidney can actually do the job of 2, 80%. So as long as you have a donor, you're a fit candidate, the options are available to you. And I'm sure once we spread more awareness, that funding and that support is going to be helped. The Bahamas Kidney Association, we're trying to raise as much funds as possible. Right now, we do a lot through medication assistance because, to be a kidney patient, it's very costly, public and private.
Well, my question really was, do you help us? Let's say, for example, it's not a financial problem that we have, but it's just like, okay, if if there isn't a kidney program here where I can just find a donor here in the Bahamas, and you're saying to look abroad, where's the safest ways? Is there somebody to help with that?
Through your kidney specialist. For me, example, I work with various persons in different countries with transplant centers. So if I have a patient who is qualifies for kidney transplant, I'd refer them. They'll already start their meetings, and they would actually be listed. So all of my patients, I try to make sure if they qualify, they're listed for a kidney transplant.
All right. Well, ladies and gentlemen, if you feel so you might have an issue with your kidneys and you're looking for a specialist, once again, I got Dr. Levard Roberts in studio, and he is here to help you out. We're going to take a short pause to stay alive, and afterwards, we're going to jump right back into it. All right?
All right.
It's all happening right here on Global 99.5 FM. Keep it locked.
Celebrating brilliant.
Like, well, no, we can't discuss that. You know? I think they had a mind of people going missing and kidneys all of a sudden popping up. Yeah.
I try not to say that.
Yeah, no.
In some places,
Well, once they go through y'all, you know, y'all make sure they're safe.
Right.
Yeah, that's all. So don't try to do it yourself. This is not one of those DIY situations. No. Even it's the same thing almost like with plastic surgery, right?
Yeah,
You should have somebody that you trust. Don't look for the best prices.
And then also someone can follow you.
Yeah. Exactly. You see? So okay, we got 2 more commercials. That should be like another 2 minutes, and then we can jump back in. This one look like a stressful job for you, though. I don't know. You seem so relaxed and like calm, cool, collected. You know. How long now? You said you've been in it?
Medicine or
Both.
medicine
15 years. Wow. Do you do anything like bush medicines, or it's all just like?
I keep it evidence based. The problem with most medicine is not studied.
It's not studied.
Yeah, no FDA checks balance. Yeah, it's this push of just still saying all natural. So a whole new child.
So seeing that we're here in the Bahamas and we basically bush medicine children.
That's me.
So why don't we have, if it's not regulated, right? Isn't that something that we could possibly start here? I mean, we have the natural resources, right? Yeah.
So the US can.
That they don't want to. I'm pretty sure they don't want to.
Problem is research.
Because it is formulated and tested to meet its available now. NASA Motor Company.
What's that?
It's the midday with 𝗟𝗲𝘁'𝘀.
Okay.
On 99.5 FM.
It's Global 99.5 FM, and we are back. You guys are halfway missing our off-air conversation, but that is okay. I'm going to invite him back, and we will have that conversation. But once again, we are talking about
kidney disease. So, Dr. Roberts, let's talk about the Bahamas. How common is kidney disease here? And are we seeing a rise in the cases?
Yes, so kidney disease, unfortunately, is on the rise. In 2017, we saw as the 12th leading cause of mortality or death. That was worldwide. It's expected to be number 5 on the list by 2040. At present, we have statistics about 1 in 10 persons, almost 900 million people worldwide affected by kidney disease, and that kind of ratio is similar to what we see here. Diabetes being the leading cause of kidney disease. I think 50% of our patients on dialysis here in the Bahamas is because of diabetes.
Wow.
And then hypertension a close second. And, most of the time it's late presentations, and that's why we see very exponential growth of kidney disease. So just got to promote awareness.
Wow. Okay, so now I've been complimenting you all day. You don't seem stressed at all. This seems like a breezy job. He just gets in there, gets the job done, goes home with a smile. But my question is, are there enough specialists and resources locally, or do we face challenges in access to kidney care?
So I think healthcare in general, we see an influx of need, mainly because a lot of information, more testing, more diagnosis, people living longer. So by extension, there's always going to be an increased need of healthcare all around. With kidney disease being on the rise, there's always going to be a need for more nephrologists. I think roughly we have about 5 to 6 nephrologists currently in Nassau. So we are a bit short-handed, but we're available in many forms, private and public.
And this is something they can study in UB, right?
Right now, so to be a nephrologist, you have to first become a physician, then after being a physician, an internist, and after being an internist, then become a subspecialist in nephrology.
Well, it's a real process.
Yeah, so unfortunately not here in the Bahamas, not here in the Bahamas just yet. University of West Indies, Jamaica, Trinidad are options as well.
Okay. Now, for those listening, we're almost wrapping up, but for those that are listening who want to take action, what resources are available for kidney screening or awareness programs here in the Bahamas?
So, Bahamas Kidney Association, we've been trying to promote awareness. We partner with 𝗏𝗏𝗹𝘆 to actually provide free screening. So all you have to do is actually sign up with the BKA, and you'll be able a candidate for free screening.
Okay.
For those who are missed that opportunity or unable to do so, there's also your primary care physician, whether it be through the public, NHI, or private system. All it takes is a question, the right questions. And just ask your doctor, what percentage is my kidney functioning at? What's my GFR? And then ask what stage is that kidney disease, if any? Is there any blood or protein in my urine?
Mm-hmm.
If any of those questions come to be yes, there is, or your kidney function is low, that means you need to see a kidney specialist.
Okay.
Mm-hmm.
All right, Dr. Roberts, before we wrap up, what are 3 simple daily habits everyone can adapt today to keep their kidneys healthy?
Okay, so diet. I always like to start with diet. So, we try to implement new things to the diet, but sometimes it's just something simple as just eating right.
When you say eating right, does that mean stick to the Bahamian meal, y'all? That piece of rice won't be able to do that.
What type of meals should you be eating?
So a more vegetable-based diet.
Okay.
There's actually study proven that vegetarian or vegan-based diet actually promotes wellness and it protects the mind and the body.
Wow.
And we have to work on our portion sizes. Half the plate vegetables, quarter the plate lean meat, and a quarter the plate carbs. That's what we call the plate method to our diabetics.
Okay.
And exercise. 30 minutes, about 5 days a week. Staying active, it helps to promote a healthy blood pressure, healthy weight, and actually maintain and decrease the chances of diabetes, hypertension, heart disease, kidney disease. Okay? And get checked out. Get your annuals done. If you're, at age of 18, you should at least have an annual every year to make sure you're doing okay.
Okay.
Those are the 3 things I would say.
And I like the fact that he didn't overdo it with the exercising, y'all. Okay, 30 minutes. 30 minutes is all it is. You all know Jay Wise has been trying to get me to go to the gym for a minute. Okay, as I say there, but it's only 30 minutes. It's not going to take your whole day at all. Okay, 30 minutes. Okay. And finally, as we celebrate kidney health, what message would you like to leave with our listeners?
ignorance is not bliss.
Okay.
Know your status. Know your numbers. Okay, and be your own advocate. I'll leave it at that.
And you also said you have access to free testing, right?
Correct. So
Okay.
with the Bahamas Kidney Association, go to our website, bahamaskidneyassociation.org, and you'll find many, many modalities and information and find out ways to actually get checked out.
Okay. I don't drink water, but I feel as though we'd be hypocritical if we say, hey, go and get tested, y'all. And the global staff has not been gone to go and get tested as yet. So with all the fear that I have, I'm somebody that drinks juice every day. Okay, all day, every day. I barely drink water. And I'm like, if my pee isn't too yellow, maybe I'm okay. But I'm going to go ahead and get checked. Okay, we're going to do that. So I want to urge everyone that is listening to also go ahead and get checked. Now, Dr. Roberts, thank you so much for sharing your knowledge and helping us understand just how important our kidney health is. And don't forget, the kidneys is responsible for 10 different roles in your body. It's not something you should be taken lightly at all, right?
All right. Thank you for having me.
To our listeners, your kidney works 24/7 to help you stay healthy. So take care of them, drink water, eat healthy, and get regular checkups. We're going to wrap it up. Any other shout outs you'd like to do before we do?
No. Just please check Bahamas Kidney Association. Donate. We are a non-profit organization. We do what we can for our Bahamian people.
All right.
We're going to take a short 5 to stay alive after the break. Of course, more music comes your way. Keep it locked right here in the hottest station in town, Global 99.5 FM.